Hi everyone, I am Dr. Brandy Simmons and I am a pediatric prenatal chiropractor here in the DFW area. Today I'm going to go over a couple simple exercises that you can do for your baby's neck to add more mobility in their cervical spine. This is super important when we're trying to prevent things such as head turning preferences, head tilts to either side, or flattening of the skull on either side as well. And these can be used in conjunction with treatments outside of office to help your baby if they're already exhibiting some of these preferences. So the first one we're going to start with today is going to be rotation. And the goal of this exercise is to be able to first turn your baby's head towards the side that they are not preferencing. And the easiest way to do this is to have baby face towards you. And if they have a head preference on turning on this side, then we're going to start with turning to this side because this is the side that they struggle with to turn to the most. Now, because they have a preference, it's going to feel better for them to turn their head that way. So they could cry and have some discomforting when you're turning it the opposite way. And that is totally common. But our goal is to have them to be able to turn that way without crying in the end of the exercises. So we're going to be mindful first that we aren't going to be grabbing along the jawline or the neck, because mentioning that they could have some discomfort in that area. So we're going to use the outside hand and we're going to brace the top of the head and just slightly turn to this way and hold for about 2 to 3 minutes. And you can kind of bounce them back and forth to soothe them. Now if you get like a minute in and your baby is crying or super fussy, then we can stop and come back to that exercise later. Or you can simply turn them back to the preference size for a brief moment to give them a break, and then back towards the opposite side for another exercise. The second one we're going to go over is going to be lateral flexion, and this is going to be more for helping with head tilts to either side as well as flattening on either side of the skull, and to add more mobility from side to side bending in the cervical spine. This one is also a very gentle exercise. You're going to have your baby lying on their side in your arms. So this arm is going to go slightly right under the neck on this side. So if your baby has a head preference on this side, that side would go down first. Then you're going to use your outside arm to go right in between the legs over the abdomen to the shoulder, and you're going to use that hand to kind of just stabilize the shoulder on the bottom there. And this underneath hand is going to go right over the ear, and we're going to gently bend the baby's head up and tilt it up. You're going to hold for a second and back down, and just repeat that a couple of times. Now, like I said, they could have a lot of discomfort with this exercise, so be very patient with your baby. If you need to stop and take a break, you can also try the other side to relieve some of that discomfort and then go back into that side, or like I said, just take a break and come back to it later. The goal is to be able to do these exercises a couple times a day without any discomfort or crying or fussing. No, we don't want you to try and fight your baby in these exercises. Eventually they will learn to like them the more you're doing them outside of your visits in office. And this will be very helpful in preventing any of those conditions such as flagiocephaly or torticollis and things like that, and just giving your baby all around better range of motion in their cervical spine. I hope this video helps you guys at home kind of walk through and guide you into doing these exercises. If you have any questions, please reach out to us. You can reach us at thewellnesshivechiropractic.com, and you can follow us on Instagram at thewellnesshivechiro. Thank you.